Now we're going to begin with Technique A, the procedures that we suggest might be adopted by greyhound trainers in the kennel to detect injuries of their racing greyhound, procedures that should not take more than 2 to 3 minutes. The beginning technique would be to check to see the mobility of the major joints of the greyhound. Begin with the neck. The head should be able to point straight up and the nose come down to touch the front of the chest. Gently, we can move the head around so that the nose touches the ribs on the right side, and then move the head gently around to check that the nose can touch the ribs on the left side. These procedures will ensure that you have no major injuries to the vertebrae, the bones of the neck, or to the muscles on either side of the neck. Now we check limb mobility. The elbow is raised to the level of the saddle area at the back to check full flexion of our shoulder joint. Then we extend the limb fully to parallel with the ground to check that the shoulder will withstand full extension without pain or discomfort. Now the toes are brought back to the level of the hip. This will ensure that the biceps brachii muscle does not slip from the bicipital groove at the top of the humerus. Any displacement of that will enable the elbow to go straight and you'll not maintain the normal 90-degree angle. The wrist and elbow are then flexed using sufficient pressure to touch the main pad to the back of the forearm. Again, one more forward extension of the foot. Double check that that wrist extends fully and completely and doesn't drop down partially, which would be associated with injuries to the tendons of the forelimb. The same procedure is then adopted on the other side to make sure that both limbs are fully functional. Now, I'd suggest that we move along to examine the spinal column. Both neck and spinal column may be damaged if the greyhound falls and rolls on the track or has a head-on collision with other greyhounds during the run. All that is required is downwards pressure on the vertebral spines. These are the bony processes along the spinal column. With the edge of the hand, we press down on those spiny columns without pressing on the muscles at either side. Now we move to the hind limb area to examine the hip joints and the lower limb joints. With the hand on the opposite hip to balance the greyhound, we then extend the leg. Grasping the lower foot, we bring the toes to the level of the shoulder joint. We've now examined the full range of movement of the hip joint. To check flexion of the stifle joint and the hock joint, we place the pads in the palm of the hand, not grasping the upper part of the foot, pads in the palm of the hand. The other hand is placed on the top of the stifle joint, which is the lower part of the thigh, and then we close the limb fully to the point of resistance and ensure that there is no pain or discomfort. Note also the distance between the toes and the stifle joint, because we must ensure that that is the same distance on either side. Then we do the same on the other side. Extend, toes to the shoulder joint, then fully flex. Now we'll move to the lower limb and examine the toe joints. Normally the toes should bend at a 90-degree angle to the foot. And in this case there is no problem. If you have a resistance or pain or discomfort, then of course we will have a sesamoiditis problem. The bones of the hind foot, the metatarsal bones, just run your hands along the metatarsal bones to feel for any swelling or distortion. Now we must check the tarsal ligaments. These ligaments will be injured prior to fracture of the hock bones. This is merely a thumb and finger procedure, with the finger at the back of the inside metatarsal bone and the thumb on the front of the outside metatarsal bone, and the foot is rotated using sufficient force to move the stifle outwards. And we do that the opposite way. Then the same procedure is adopted on the opposing limb. Having checked both hind limbs to that extent, we would then move onto the front limb. With the procedure on the front limb, again, the wrist is flexed to touch the main pad to the back of the forearm. Supporting the forearm, we examine wrist mobility. The next procedure is the stopper bone. The accessory carpal bone at the back of the wrist can be subject to enormous pressures during the run. Downwards pressure on the accessory carpal bone will detect any abnormality in the insertion of the one muscle that attaches there, the flexor carpi ulnaris. Upwards pressure on the stopper bone will check any injury to the distal accessory carpal ligaments, the ligaments on the support structures at the bottom end of the accessory carpal bone. We then examine each of the toes. The toes, of course, are subjected to damage. We may have broken nails, infected nail beds, dislocated toes, sprained toes, split webs, as we have in a case like this. Again, we check for sesamoiditis by bending each toe at right angles to the foot. Finally, we examine the wrist for rotation using the same procedures that were used in the hind limb with sufficient force to move the elbow. Now, this procedure in the kennel would take approximately 1.5 to 2 minutes. It would enable us to detect major problems affecting the joints and the tendons and the ligaments in both limbs. There is one other procedure I'd suggest that should be adopted and would take about 30 seconds. And that would be to examine the 10 major sites for torn muscles. These are the areas that are most commonly subjected to severe muscle trauma. We realize that every muscle can be damaged, but these are the ones that the trainer should be looking at in the kennel. And these are the upper portion of the long head of the triceps. On each side, when these muscles are torn away, we get massive swelling and bleeding. In the early stages, one will detect minor swelling and discomfort if the muscle is palpated with the thumb and finger just running around the edge of the muscle and then over the belly of the muscle. The second area is the flexor carpi ulnaris, the muscle at the back of the forearm that attaches onto the stopper bone or the accessory carpal bone. Again, with thumb and finger, feel the tendinous insertion and then run up along the belly of the muscle. 2 muscles on the forelimb. On the hind limb, we would then be looking at the triangular muscle on the top of the thigh, the tensor fascia lata, very commonly torn in the racing greyhound. It's a matter of palpating along each of the margins of the muscle and then over the belly of the muscle. The next muscle most commonly torn is the pectineus muscle on the inside of the groin, and we'll now take a moment to examine that. If I raise the leg, the pectineus muscle on the opposing side can be seen as a finger-shaped muscle on the inside of the groin. It can be detected by feeling the major artery on the inside of the limb, and then just behind that artery is the pectineus muscle. When these muscles tear, it is quite obvious from the bleeding and the swelling that a major trauma has occurred there. So if you view the inside of the thigh through the transparent skin on the inside of the thigh, torn muscles can readily be seen, but you need to palpate to ensure the degree of damage that has occurred. Simply slide the hand on the inside of the thigh, feel that pulsating artery, and then just behind the artery you'll feel the pectineus muscle. And finally, we examine the gracilis muscle on the inside of the thigh. The gracilis muscle, you'll recall, takes its origin from the bottom of the pelvis and runs all the way down on the inside of the thigh to be inserted partly to the hamstring muscle, partly to the tibial bone, partly to the Achilles tendon. Now, the gracilis muscle may be subjected to damage if the greyhound's hind limbs spread during the run due to slipping or to an obstruction from other greyhounds. The muscle can be readily seen and injuries detected by the swelling and bleeding which is associated with major tears. Palpation will tell you if the muscle has torn from its upper end or its lower end, factors which make a major difference to the future performance of the racing greyhound. So the muscles will be examined by palpation, again around the front and back edges of each of the muscles and then over the belly of the muscle. So we have examined the 10 major muscles subjected to tearing in the racing greyhound. 1, 2, both on the front limb. On the hind limb, we have the triangular muscle on the top of the thigh, the tensor fasciae lata, the pectineus muscle on the inside of the thigh, and the gracilis muscle on the inside of the thigh. This procedure can be adopted by any trainer and would take no more than 2 to 3 minutes. It would enable the trainer to detect injuries in the early stage that are going to affect future performances. It will also enable the trainer to detect injuries that will require veterinary attention, or if the trainer is unsure, he can take the greyhound to the veterinarian for a full clinical examination. The next procedure will be the full clinical examination adopted by the veterinarian.